So this next section of the video is about a few tips and tricks on how to suture properly. Suturing is obviously a sort of practical skill. It's something that you may or may not necessarily be able to learn from a book. That's the purpose of these videos, and really nothing is as good a substitute for actually doing it, watching experienced people operate, and just doing it over and over again until you become you get a feel for it. You develop a muscle memory. The first tip is how to open a suture packet and how to handle the surgical instruments, the suturing instruments. So the first thing to say, this is how you open a suture packet. This packet outside bit is not sterile. The runner, the person who's not scrubbed in theatre, gets this and does that and hands it to the scrub nurse who is sterile, who then takes it out of the packet. If you have a look here, the packet is designed so that you just grab the needle, you pull it out, and then you pull the string out. This is designed so that you don't actually touch the needle at any point. And the way you hold the needle holder is by grabbing the needle about 1/3 of the way from the string end and about 2/3 of the way from the needle point end. And then the adsense, or your pickup, you don't hold it like this as many students do. You hold it like this, and you hold the needle holder with your thumb in one, and then your ring finger in the other, and then your index finger resting on the actual needle holder. The next bit of this video is about 3 quick tips on how to suture well. The first thing is that you need to take into account the fact that there will be a degree of edema and soft tissue swelling following your suturing, following any manipulation of tissue. And you need to kind of allow for that in the suturing. So good suturing technique is a balance between tight enough sutures that kind of oppose the tissues and do the job of, closing the wound. And so that it needs to be tight enough to do that, but not too tight for it to strangulate the blood supply and potentially cheese wire through following the swelling and edema post-operatively. The second thing is about how to bury the knot. Okay, so in some situations, certainly in deep sutures of the skin, particularly if you're using a material that is a bit spiky like monocryl or PDS, what you don't want is the ends of the suture to poke through the skin, and sometimes they can. So what you do is to bury the knot. And the way to do that is to take a deep bite first, come out superficial, and then go back in again, superficial followed by deep, so that when you tie the knot gets buried inside. Another example of this, for example, if you're suturing on the tongue, you want to bury the knot so the patient doesn't catch the suture between their teeth when they're chewing or biting, and so you bury the knot so that it doesn't irritate them. And of course you would use a resorbable suture in that situation. And then the third tip is about uneven levels. So if you imagine this can be both vertical and horizontal, and more commonly in a vertical situation. So if there are uneven levels, so if one layer is a little bit lower, what you want to do is when you suture, you want to take a deeper bite of the lower layer and take a less deep bite, a more superficial bite of the higher level, so that when you tie the knot, the deeper layer comes up to meet the suture on the other side. This is a very important thing to remember, because otherwise you will get a little mismatch, there will be a little step, and obviously a cosmetic or a functional deficit. A couple of other bonus tips are leaving a knot on the side. What you want to try and do, if at all possible, is to try and leave the knot on the side when you do a skin suture. And the reason for that is because as you leave the suture for a few days, a lot of debris gets collected in the nooks and crannies of the suture, dead keratinocytes, dead skin cells, bacteria, sort of crud and cruft that builds up over a period of time. And obviously what you don't want is for that stuff to be in contact with a healing wound. So as much as possible, you want to try and leave the knot on the side. And then another bonus tip is whenever you suture, it's very important to bring the layers together, not just oppose the tissues, but slightly evert them. In other words, slightly rise them up as opposed to invert, which is the reverse. You don't want that. What you want is to evert them, and the reason for this is that as the wounds heal, wounds generally tend to heal with a degree of scarring and a bit of fibrosis, and fibrosis and scarring implies a degree of shrinkage. So what you want to do is to, again, allow for that, so that when the wound heals, that eversion flattens and you get a flat wound, rather than a sort of a wound that is slightly coming apart at the seams, or even worse, you get a crater. So always remember, when you tie the knot, leave the knot on the side and try and slightly, ever so slightly, evert the wound edges to allow for the degree of fibrosis and scarring and shrinkage post-operatively. So, of course, there are many different kinds of sutures. The ones you've just seen, a simple interrupted, is about as basic as it gets. It's the most common suture that's used, and of course it's the most commonly examined in medical school exams and in OSCEs. A mattress suture is often used if there's a lot of tension in the system, so it tends to bring the underlying structures together a bit more, to get a bit more of that eversion I was talking about. There are many different kinds of sutures other than those. There's, for example, a running suture. There's a continuous subcuticular suture, which are sort of outside the scope of this video. I might do another video about them at another date. So if you want to see more of these videos, it would be great if you can subscribe to my channel and hit the like button if you got value out of this video. But another one that is commonly used is a hand tie. So let's have a quick look at how to do a hand tie. So to do a hand tie, imagine this finger is a blood vessel. You grab the tip between your index finger and your thumb. You put it around the blood vessel, and then you leave that side on your 3 fingers. And then you bring this over parallel to the other side. And then your ring finger, your middle finger, picks up that and then loops it around. And it's very important to make sure the knot is flat. And then you tie it. And that includes the blood vessel. To reverse it and to lock it, you grab it, but this time between your middle finger and your thumb, and you leave a bit on your index finger, and then you bring that over like this, and then instead of the middle finger, this time your index finger loops it, and then you tie it in the opposite direction to the first knot. So let me show you again one more time. This is the first one. And then to lock it, and then you can do one more for belts and braces. This is how you hand back the needle back to the nurse. You never have a needle like that and then you hand it to them. What you do is you turn it like this to make kind of a D, and then you turn it around and then you hand it back in that direction. So let me show you again. You never do that because there's a risk of injury. What you do is you secure the needle tip against the needle holder, and then you hand it back to them in that direction. So thank you very much for watching so far, and as promised earlier, this is a section about how to succeed in exams about suturing. So for example, an OSCE station. The way to think about this is to divide this into 3 sections. 1 is about examination of the wound. 2 is about preparation of the equipment and yourself. And then the 3rd one is about the suturing, the technique, etc., and the aftercare. So let's talk about the first section, which is examination of the wound. So what you want to do is to mention that you will examine the wound. You would want to assess for any distal neurological or vascular deficits. You would want to, for example, assess whether there's any foreign body or any grit or any dirt in it, which would then necessitate you talking about possibly an X-ray to rule out a foreign body, or tetanus injection, for example, if there's any contamination of the wound. You would want to talk about, obviously, hemostasis. You would want to make sure that there's no active bleeding, and essentially just make sure that the wound is generally clean and ready to be sutured. So that's the first section. The second section is about preparation of yourself, which would be putting on the apron. PPE is appropriate, certainly washing your hands or using a gel to disinfect your hands, and then putting on a glove. Then obviously gathering all the equipment, the suture packet, the syringe, the needle, the local anesthetic solution, and using an aseptic technique, a sterile technique really, in a kit. Make sure that you open the suture correctly, like I showed you earlier. Make sure you draw up the local anesthetic in a syringe with a needle, and then discard of the sharps appropriately. And then preparation generally of the field. Make sure that you drape the wound and get ready to do the actual suturing. It is obviously completely artificial in a situation in an OSCE with a rubber area that you have to, suture, but most people obviously make allowances for that. They also make allowances for the fact that you might be a bit anxious and a bit nervous, your hand might be shaking, a bit sweaty and so on. But the thing to do is just to ignore all of that and concentrate on the next step ahead. And then the third section is about suturing itself. So obviously the suture technique that I showed you, making sure that you allow enough width of the suture, between the wound and where you actually put the suture in, 90 degrees to the skin. It's not like a sewing machine that are too close to each other, which would strangulate the blood supply. How you handle the instruments, how you hold the needle holder, how you hold the adsons. And then obviously once you've put 2 or 3 sutures, then disposal of the sharps appropriately. And then you would mention a few things about wound care and aftercare. So for example, when should the patient have the sutures removed, what kind of dressing you would use, what sort of creams or sort of adhesive dressing you would use as appropriate, and about how to look after the wound generally, about washing, shaving, that sort of thing. Just obviously none of these are very specific, but you want to make it clear to the examiner that you have thought about these things, that it's not just enough once the last suture has gone in and you can be on your way. This is a patient who needs a bit of aftercare, and it's important to pay attention to those things. And then of course, to do all of this in a slick, professional, proficient way, to look like a doctor. I have examined for OSCEs for many years, and like I said, most people make allowances for the fact that you might be a bit anxious, especially in sort of technical things like performing a procedure, performing an examination. It is normal to be a little bit anxious. For example, your hands might be a bit sweaty when you want to put the gloves on and so on. But what you want to do is to try and come across reasonably proficient, reasonably professional, to look like you've done it before. It does of course help if you have done it before and practiced and watched this video. And all in all, as I said, most people make allowances for that, and most people do pass, so you'll be fine. Thank you very much for watching this video. I know it's been a long one. I appreciate you watching to the very end. If you feel you got value out of this video, I'd really appreciate it if you can hit the like button, and I'll see you on the next one.